Hello viewers, welcome to Healthfare. Healthfare is a program that alerts and educates you on health issues and also help you prevent diseases and improve your health, showing on Freetown Television Network channel 35. I am Agnes Nyamasiatomi. Join me as I bring you a reliable first aid health tips and Medicare education on the known and unknown ailments to be preventive and care solutions. Today, I'll be discussing about HIV and AIDS and STIs, which is also known as the STDs. But before that, let's get this commercial. I'll be right back to take you through the HIV and AIDS and STIs, which is also known as the STDs. Don't go anywhere. I'll be right back. Hello and welcome to Healthfare. Healthfare is a program that will be alerting and educating you on health issues. If you ask many people around you today what health means to them, we all have different understanding of what health is. Health is the main factor in human because it's the ability to adapt and self-manage in the face of social, physical, and emotional. Health is just more than a good and bad feeling. Because he who has health has hope, and he who has hope has everything. Today, we have different cases, different diseases in our various hospitals. Your health is affected by the aspect of your lifestyle, such as what you eat, sleep, smoke, stress, alcohol, and drugs. These and more will be coming to you on your screen, Freetown Television Network, with me, your host, Agnes Nyamasiatomi. Keep watching Healthfare. Welcome back from that break. In case you're just joining us, this is Healthfare on FTN channel 35 Freetown, and I'm Agnes Nyamasiatomi. The topic for today is HIV and AIDS and STIs, which is also known as the STDs. But before I proceed, I would like us all to know what the meaning of the abbreviated words, the AIDS, HIV, STIs, which is also known as the STDs. AIDS is known as the acquired immune deficiency syndrome, and HIV, which is the human immune virus, and the STIs is the sexually transmitted infections, also known as the STD, which is the same as the sexually transmitted diseases. Let's talk about STIs. What are STIs? STIs, they are infections that causes warts in various parts of the body, and also is a common sexually transmitted diseases that are marked by genital sores and pains. The STIs, which is known as the sexually transmitted infections, can be in various types, but here are the three main types. One, we have the HPV, which is known as the human papillomavirus infection, and we also have the genital sores, and the last one is the chlamydia bacteria. Let me take you through those three steps one at a time. The HPV, which is known as the human papillomavirus infection. The HPV is an infection that spreads by sexual contact, and it also requires a medical diagnosis. Normally, people that have HPV do not develop any symptoms, despite sometimes the symptoms may be warts on the genitals or around the skin. And the next one is the genital sores. The genital sores is also a sexually transmitted infection that affects both men and women. Sometimes you start feeling pain, itching, and sores may appear at first, and it is usually self-diagnosable. They causes ulcers and scabs. And the last one is the chlamydia bacteria. The chlamydia bacteria infection, it affects people of all ages, but it's most common in women. Alright viewers, let's hold on STIs for now, and let's get some information on HIV and AIDS. But before that, let's get a quick break, and I'll be right back to take you through the HIV and AIDS. Hello and welcome to Healthfare. Healthfare is a program that will be alerting and educating you on health issues. If you ask many people around you today what health means to them, we all have different understanding of what health is. Health is the main factor in human because it's the ability to adapt and self-manage in the face of social, physical, and emotional. Health is just more than a good and bad feeling because he who has health has hope, and he who has hope has everything. Today, we have different cases, different diseases in our various hospitals. Your health is affected by the aspect of your lifestyle, such as what you eat, sleep, smoke, stress, alcohol, and drugs. These and more will be coming to you on your screen, Freetown Television Network, with me, your host, Agnes Nyamasi Atomi. Keep watching Healthfare. It's Healthfare, and we're showing on Freetown Television Network, channel 35, Freetown. And we are discussing about HIV and AIDS and STIs, which is also known as the STDs. We've talked about STIs, what are STIs, and the types and how they've been contacted and the infections they caused. Now we're moving on to HIV and AIDS. AIDS, which is known as the Acquired Immunodeficiency Syndrome. It's a syndrome that causes a virus known as HIV. And the HIV is a virus that alters the immune system, making people much more vulnerable to infections and diseases. And this susceptibility worsens when the syndrome progresses, because the virus itself can be found throughout all the body tissues, and it can be transmitted through body fluids by an infected person. The HIV virus itself, the virus attacks the immune system that is known as the CD4 cells. And those CD4 cells, they are subsets of T cell. As in, the virus progresses in the absence of the antiretroviral therapy. You can hear those names in the hospitals, which is known as the ART. And the rate of the virus progression varies widely between individuals, but it also depends on many factors like the body of the ability to defend against HIV, and also access to healthcare, the presence of the other infections, and the individual genetic inheritance. And now we've been hearing about HIV and AIDS, the AIDS which is caused by the HIV virus. Now let's know how the HIV virus is transmitted, because we've been hearing about HIV virus. The virus, it's been transmitted in three main ways, which are one, the sexual transmission, and the parental transmission, and also the blood transmission. Let's go through them one at a time. The sexual transmission. This happens when there is contact with an infected sexual fluid. Absolutely, this is trying to say having sex with an infected person without using condom. That means your sperm and the person's sperm has been contacted. They have been communicating whatever infection the person is having, despite HIV, like the gonorrhea and syphilis. You are going to be contacted with that same infections because you've had an unprotected sex. And the next one is the parental transmission. The parental transmission, a mother can transmit HIV to her child through childbirth, pregnancy, and also nursing. The last one is the blood transmission. The blood transmission, the risk of transmitting HIV through blood transfusion in developed countries is extremely low because of the reusing of syringes, haircut equipment in barbering shops and also salons. But let me elaborate on the two places, the barbering shops and the salons. The barbering shops, 10 out of 100 barbering shops can have the time to sterilize their equipment before reusing it on someone else, because there are some bacteria and microbes. Even if you autoclave them, you sterilize them, you flame them, they are not going to die. For example, the facultative anaerobes, they survive in both heat and cold weather. So people do not really have time to sterilize their equipment before reusing it on the next person. So my advice to my brothers and fathers out there, whenever you want to go to this barbering shop to get your haircut, get yourself your own machine. Don't even use it on your son, your brother, or your father. It should be used 1:1. That one is for you alone. After using it, take it home, sterilize it, keep it for the next use. And sometimes I can even say the guys are far more better than the ladies when it comes to that. Because the salons that we go for our hair to be done, you can see when they want to do this weave on and all, after using the needle on one person, maybe the best they can do, just get some antiseptic, wipe the needle, that's all. While the microbes that maybe just weak microbes that will die, but the strong ones that survive will, in both heat and cold weather, they are there growing, multiplying. So the increase of HIV will be going rapidly every day. The infection will be spreading. What if people don't get infected with HIV through sex alone? Look at what I'm saying, like the salon and the barbering shop. So the best thing you can do to protect yourself, get yourself those instruments whenever you're going to the barbering shop or salon. Take it along. After use, you go home, sterilize it, and keep it for the next use. All right, now we'll be taking a break, and I'll be right back to take you through the symptoms. How can you detect that someone has HIV without doing the laboratory test? I'll be right back. Hello and welcome to Healthier. Healthier is a program that will be alerting and educating you on health issues. If you ask many people around you today what health means to them, we all have different understanding of what health is. Health is the main factor in human because it's the ability to adapt and self-manage in the face of social, physical, and emotional. Health is just more than a good and bad feeling, because he who has health has hope, and he who has hope has everything. Today, we have different cases, different diseases in our various hospitals. Your health is affected by the aspect of your lifestyle, such as what you eat, sleep, smoke, stress, alcohol, and drugs. These and more will be coming to you on your screen, Freetown Television Network, with me, your host, Agnes Nyamasiatomi. Keep watching Healthy. Welcome back from that break. Now let's go to the symptoms of HIV. How can you tell that someone has HIV without doing the laboratory test? The worst of it is that people that have HIV do not develop any symptoms until several months, sometimes even years. Despite some people develop symptoms, 86% of people, they develop symptoms similar to flu that last for 2 to 6 weeks, which is known as the acute retroviral symptoms, like fever, chills, joint pain, muscle aches. You have the enlarged glands, red rash, etc. And when these initial symptoms disappear, there will be no more symptoms for several years, and this particular stage is known as the asymptomatic HIV. And if this stage is left untreated, the patient will start developing dry cough, blurred vision, and also fever above 100 degrees Fahrenheit, which is equivalent to 37 degrees Celsius, for weeks. All right, we all know that people are scared. So many people are afraid of getting tested for HIV because of how the society sees you. Yeah, everybody will isolate themselves from you. You'll be marginalized. Nobody want to talk to you. No one goes closer to you. There are so many misconceptions about HIV and AIDS. But the disease cannot be transmitted by shaking hands, hugging, casual kissing, sneezing, touching on broken skin, sharing toilets, mouth-to-mouth resuscitation. So if you believe you have been tested and you are HIV positive, go to the hospitals, because there are emergency HIV pills given out to those who are HIV positive, which is known as the post-exposure prophylaxis. We call it PEP. So if an individual believes he had been exposed to the virus within 72 hours, which is 3 days, the anti-HIV medication can stop the infection, and the treatment should be taken as soon as possible after contact with the virus. The PEP is a treatment best lasting for 4 weeks, a total of 28 days. Monitoring for HIV will be continued after completion of the treatment. HIV is treated with antiretrovirals, which is known as the ARV. They fight the HIV infections and slows down the spread of the virus in the body. We all know that being diagnosed with HIV can be very distressing, and feelings of anxiety or depression is common. So if you feel anxious or have symptoms, seek medical help immediately, because remember, being healthier do not have to be complicated or time consuming. This is Healthier. We have discussed about STIs, which is known as the sexual transmitted infections, and STDs, also HIV and AIDS. We discussed about what are STIs, the types of STIs, and HIV and AIDS, how the virus came about, the infections, and how they are being transmitted. All right, viewers, I hope you've all learned from my topic today, which is the HIV and AIDS and STIs, which is also known as the STDs. Thanks for watching, and join me next week, same time, on Freetown Television Network, channel 35. I'm Agnes Nyamasiatomi. Thanks for watching. Hello and welcome to Healthier. Healthier is a program that will be alerting and educating you on health issues. If you ask many people around you today what health means to them, we all have different understanding of what health is. Health is the main factor in human, because it's the ability to adapt and self-manage in the face of social, physical, and emotional. Health is just more than a good and bad feeling, because he who has health has hope, and he who has hope has everything. Today, we have different cases, different diseases in our various hospitals. Your health is affected by the aspect of your lifestyle, such as what you eat, sleep, smoke, stress, alcohol, and drugs. These and more will be coming to you on your screen, Freetown Television Network, with me, your host, Agnes Nyamasiatomi. Keep watching Healthier.